Pathology of the wrist joint can affect a patient's range of motion, which in turn can have functional implications in activities of daily living. Begin with the patient seated with their hand in neutral, in most cases approximating the patient's range of motion to normal values and comparing side to side is sufficient. First, have the patient turn their palm towards the ceiling to test supination. Then get the patient to turn their palm towards the floor to test pronation, both of which are normally 90 degrees of motion. From there, have the patient bring the back of their hand up towards their forearm to test extension, and then bring it down in the opposite direction to test flexion, both of which are normally 70 to 80 degrees. Then have the patient turn the pinky side of their hand towards their forearm to test ulnar deviation, which is normally about 30 degrees, and then turn the thumb side of their hand towards their forearm to test radial deviation, which normally is about 15 degrees. If the patient's active range of motion is limited in any of these movements, make sure to test their passive range of motion as well. With range of motion of the wrist complete, we next move on to finger range of motion.